Doctor, don't be bashful. Come right in here. Tom, get over so we're a little balanced here. Get somebody over here.
Perfect, guys. Thank you.
We stand closer than ever to making it possible for every American to afford to live a healthy life. Never have we been so close to reforming America's broken health insurance system. We're not over the finish line, but we would never have gotten this far without the support of doctors, nurses, medical professionals who know we need action, not excuses anymore. Excuses are not going to work. You know, this legislation is not about politics or partisanship or some poll that appears in a newspaper someplace around the country. The legislation is really about people. Our guest today, Dr. Cecil Wilson, President-elect of the American Medical Association, knows this as well as anyone. He sees patients. Patients that come to him are there, must have a distinguished service record, and he does. We appreciate his support, not only as a doctor of medicine, but his contributions to the military, where he was a flight surgeon. For us to get the support of the American Medical Association is really important, and really makes us, who have worked on this so long, have a little bit of humility. In fact, a lot of humility. The last several days, we've also received support from other organizations: Heart Association, American Diabetes Association, American Hospital Association, Federation of American Hospitals, American Cancer Society, AARP. Notice I pronounced it right today. Each of these organizations know the cost of inaction is too high. But our bill will bring needed relief to millions and millions of Americans who wake up every day without health insurance, or waking up every day afraid they're going to lose their health insurance. Like those in the medical field, our responsibility as legislators is to care for all people, not just those that are fortunate. That's what this historic reform fixes. It starts to break down the wall between a class of Americans who can afford to stay healthy and another that cannot. Americans are dying from diseases we know how to treat, living in pain because it's too expensive to ease. You hear us talk about this a lot, and have a lot lately heard us talk about this, but every day doctors like Dr. Wilson see it. They don't talk about it. He sees it. They know the bill will soon be sent to the President. It will save lives, save money, extend Medicare for 10 years, and basically save Medicare. Doctor?
Well, thank you, sir. Well, thank you, Senator Reid, and thank you all for joining us today. I'm Cecil Wilson. As you've heard, I'm the President-elect of the American Medical Association and an internist in Winter Park, Florida. I flew into Washington's snowstorm, some have said, of the century, because the message I have to communicate with you today is of critical importance to the nation's physicians and to the patients we dedicate our lives to caring for. After a close and careful review, the AMA is pleased to announce its support for passage of the amended Health System Reform Bill. The Senate bill includes a number of key benefits for meaningful reform. It will include improvements in choice and access to affordable health insurance coverage and eliminate denials based on pre-existing conditions. It will get rid of lifetime limits on health care coverage, as well as higher premiums based on medical conditions or gender. These are important benefits for those who have insurance now and for those who want it but have been unable to get it. America has the best health care in the world if you can get it. But for far too many people, access to care is out of reach because they lack insurance. And this is just not acceptable to physicians who provide high-quality care in an often fragmented system that doesn't work for them or their patients. This bill will increase coverage for preventive and wellness care that can lead to better disease management and prevention. It will further the development of research that can help patients and physicians compare treatments and make better informed medical decisions. It authorizes grants to test alternative medical liability reforms that show promise in benefiting patients and reducing the impact of defensive medicine. Over the past few weeks, the AMA communicated closely with members of the Senate about items we support and items of concern in the Senate bill. We are pleased that the manager's amendment addresses several issues. For example, the bill increases payments to primary care physicians and general surgeons in underserved areas while no longer cutting payments to other physicians. It eliminates the tax on physician services for cosmetic surgery and drops the proposed physician enrollment fee for Medicare. Passage of the Patient Protection and Affordable Care Act by the Senate will bring us close to the finish line on health system reform. There is still work to do, and the AMA will continue to stay actively engaged throughout the conference process to further improve the final bill for patients and physicians. We will work to resolve issues of concern to physicians, such as the creation of a Medicare payment board, quality improvement, and Medicare data release initiatives. In addition, physicians and advocates for baby boomers, seniors, and military families have also been engaged in efforts to fix the broken Medicare physician payment formula that threatens access to care. We commend Senators Reid and Baucus for keeping the focus on a permanent solution to this problem early next year, and we will continue to work closely with them to get that solution. The AMA is committed to health system reform that improves the system for patients and the physicians who take care of them, and we're pleased to be able to support passage of the amended Senate Health System Reform Bill. Thank you.
Senator Baucus.
Well, thank you, Leader Reid and Dr. Wilson. This is an historic moment, not only because of the legislation that's about to be passed in the Senate, but also because of the statement we just heard. There are many organizations who are endorsing this legislation essentially because they know it's the right thing to do for America. Hospitals know that, hospice, home health, pharmaceutical industry, they all know this is good for our country. But it's also historic because here's another endorsement, this by the American Medical Association. That's very important to me that the American Medical Association is not opposing legislation, but rather supports it, and is supporting it in a way where it wants to keep working with the Senate on issues that concern them. I mentioned payment provisions for doctors. Dr. Wilson also mentioned the Medicare Commission, and it's that attitude of saying, yes, this is good, it's good for the country, but also, yes, we want to keep working with you. It's that attitude of working together, of trying to find a common solution, which means so much to me, and which is not found, regrettably, in the Senate in the last several weeks. But here are groups who are not part of the Senate, outside, who want to do the right thing. This is especially important to hear endorsement from doctors. After all, it is doctors who spend more time with patients than any other group. They know what's needed. They know the problems of insurance companies denying payment. They know it's wrong that a person can't get insurance coverage because of a pre-existing condition, and they also know that it's wrong for an insurance company to rescind a policy, again, based on some minor, frivolous health condition. Dr. Wilson also mentioned the importance of eliminating annual limits and lifetime limits on benefits. Doctors know. Doctors see patients. They work with patients. And Dr. Wilson's statement also included all the reasons why that many of us have given in the past, almost a year now, explaining why health care reform is so vitally important. So it's historic because of the legislation, but also because the American Medical Association is historically taken a very positive statement, which I find comforting because it's positive, and second, comforting because it's just honest and saying, yes, there are issues we want to work with, but it's that attitude of wanting to work with us